Hello, 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 everybody. This is Irina Strunina, and this is our weekly podcast, Diabetically Speaking with Smart Move 360. This is where we meet with people who are experts and helping others to deal with this diagnosis, diabetes, or maybe prevent this from happening, or maybe help you to help others to work with that. And every time I invite healthcare professionals to join me on this conversation. And on the last Thursday of the month, I am inviting people who actually live with diabetes so they can share their experiences, how it's going for them, what was on a challenge on their health journey, what were their aha moments, and where they are right now. So if you think that you would like to for others to hear your story, please reach out so we could schedule an interview with you and let your story out, and that may help others. And today on my podcast, I have Dr. Stephen Wonder. I met with him just recently. His story, his practice is very you know, uh, could help so many people. So I thought that it would be a great idea if he will find time to meet with me for this podcast, and he gracefully agreed with me. So welcome, Dr. Steven. Welcome to the show.
Thank you very much. I appreciate the opportunity.
Absolutely. Thank you. So, can you please share with our listeners what exactly you are doing and why I personally find it's important for people to know about your practice and way how you are addressing this issue?
Sure. So I've been a functional medicine physician since 1999, and I've been treating patients with diabetes, and rather than say treating patients, been reversing actual diabetes since then. It was really based on my grandmother's experience. When I was about 12 or 13 years old, I went out to lunch with my grandparents, and the first thing my grandmother did is she laid out 12 different pills. And then I was like, well, what are all those pills for? And she said, well, the first two are for my sugar, and the next two are for my pressure, and the fifth one's for my cholesterol, and the sixth one's for my thyroid, and the seventh one's for the side effects of the first one, the eighth one's for the side effects of the second one, and on and on. But I'm like 12, 13 years old, so what do I know? I just knew that it really didn't make sense to me. And then, unfortunately, I saw my grandmother following the traditional model of care, which was metformin, glipizide, Actos, Januvia, and then eventually a couple months after that lunch, she was put on insulin, and then a couple months after that, she was on dialysis for 3 times a week. Then she had her right foot amputated, and approximately 6 or 7 months after that lunch, she was gone. And so I just saw her just going downhill, and I was like, well, that doesn't make sense. And I would always ask her, like, well, what are you doing? What are you doing? And she's like, I'm following the instructions of my doctor. And I saw that her following the instructions did not work. And what I've learned as I've been, much older, I mean, that was over 40 years ago, is that traditional model of, take this pill or take this set of pills or this injection and change your diet, lose weight, and exercise doesn't work. And the reason that it doesn't work to reverse the condition, it can help the symptoms, is because it just addresses your symptoms, which are a high A1C and your high blood sugar. But it does nothing to figure out, well, why can't I actually regulate my blood sugar? I mean, I always tell patients, think about it. If you were diagnosed at, let's just make up 50 years of age, that means for 49 years and change, you could actually regulate your blood sugar just fine, unless you weren't going to the doctor and you didn't know. But at some point, you were able to regulate your blood sugar, and now all of a sudden you can't. That really doesn't make sense. And most people look to nutrition or diet for the secret, but there is no diabetic diet. I mean, what works for one patient will not work for another patient. And, sure, you can go on Dr. Google and, okay, I should probably not eat X, Y, and Z, and that will typically help your blood sugar and help your A1C to be lower immediately, but it won't reverse the process because it's not addressing why can't you regulate your issue. And that's been my mission since, seeing my grandmother pass on many years ago.
All right. So you are suggesting that there is actually um, a way, not, I don't know, and I totally agree with you. There is a reason. There should be a reason why things started changing. And I see there are so many reasons. It's not just one reason. So how do you address that? Because there's a lot of reasons, and some people got this diagnosis earlier, some people later, some people had it out of the blue, and other people had a long family history of it. And I know that a lot of people saying everybody in my family on my father's side and on my mother's side had it. It just unavoidable. This is something in my blood. I will have it. Uh,
Well, there's the only type of diabetes that has a genetic component is type 1,
yes.
which is actually an autoimmune disease, which means the person is not producing any insulin from their pancreas, and that is genetic because it's an autoimmune disease. But there's actually many, many types of diabetes. I mean, the four that most people have maybe heard of are, well, there's type 1, which if your pancreas is secreting insulin, then you're not that. Then there's type 2, which most people think they are. And then there's type 3, which is AKA also known as Alzheimer's.
Hmm.
And then there's type 1.5, which means you have an autoimmune disease that is really the cause of your inability to regulate the blood sugar, such as Hashimoto's thyroiditis, Graves, multiple sclerosis, lupus, Raynaud's syndrome, Sjogren's syndrome. So there's a lot of different autoimmune diseases. And a good hint or a good tip for people out there is if you have someone in your blood family that has been diagnosed with an autoimmune disease, because that is genetic, not the blood sugar. There's no genetic component to type 2 diabetes. But if you have someone in your blood family who's diagnosed with one of those issues, then there's a stronger possibility that you're a type 1.5 diabetic. Or if you have a lot of females in your blood family that are having trouble getting pregnant or staying pregnant through to the end, that is also a hint for that. Or you have a lot of people in your family that have thyroid issues and or hormone issues. But the top three myths with diabetes are, they think it's genetic, and it's
Yes.
not. Now, it's the reason a lot of people do have it in their family is because it's common. I mean, 50% of the people in the United States are pre-diabetic or diabetic, and a good percentage of them have no clue that they're even in that area.
Yes.
Um, the second myth is they think it's related to their weight. Well, I can assure you that there are many people who are overweight who are not diabetic. And I can also assure you that there are many diabetics, we call them skinny diabetics, which they don't look like they need to lose any weight. And then the third one is, so it's genetic and then age. People think, well, my doctor told me I turned XYZ age, and therefore that my body's going to start breaking down. I mean, I've literally studied and read, I can't even tell you how many medical textbooks. And age is not a diagnosis. Age
Mhm.
is something that everyone goes through. So it's not a diagnosis. The key is, or what makes it a little bit more difficult is that if we lined up 1,000 diabetics and we worked them up to tell them why they can't regulate their blood sugar, there would literally be 1,000 different reasons why. No two people are going to be alike. So that means you could have a problem with the liver. You could have something called fatty liver, but there's multiple liver enzymes. So someone might have problems with GGT, another person might have problems with AST, another person might have problems with ALT. You could have adrenal fatigue. You could have leaky gut. You could have food sensitivities. You could have huge amounts of inflammation. And so and then one of the biggest findings I'm finding lately is toxicities. In other words, toxins. Everyone, is very interested in, what should I eat? What's the diet? Well, first of all, there's no diabetic diet. But if you wanted a good start, is if you're looking at the ingredients of the food and you see words that have 15 consonants or a lot of consonants, and it would be hard to pronounce the word, you probably shouldn't eat that food. And it doesn't really matter whether that food has a lot of carbs in it or not, because those big words are toxins and they close the cellular doors, which means the insulin can't get into the cells, which means you're insulin resistant. Most people have actually heard of that term.
Yes. Definitely. Well, it sounds to me that actually coming back to the lifestyle that we call healthy lifestyle is the first step. Because as you mentioned, if you have a healthy diet, but don't do the right things in terms of, movement and stress management and sleeping and all this, you have much less success with avoiding this situation in the first place. But if you found yourself there, to help the minimize the damage and get out of this damaging zone, right? So is it, do I understand it
Oh,
correctly?
go ahead. I'm sorry.
Yeah, yeah.
Yeah, I mean, think of it like this. What people need to, I call it the ABCs of reversing diabetes.
Okay.
A stands for accurate assessment.
Mm,
In other words, why can't you regulate your blood sugar? And it's going to be different for everyone. And then most of you, have just been given the diagnosis of, you have high blood sugar or high A1C. I mean, my 11-year-old daughter can look at your lab report and see, and if I say, Sophia, look and see if the A1C and the blood glucose have a big H and it's bold, well, that means the person's diabetic. Well, that's all that's been done, the majority of you. What we need is a comprehensive diagnosis that says,
yeah.
okay, you have this is a problem, this is a problem, this is a problem. And these are the things that cause the actual inability to regulate the blood sugar. And the B stands for you have to understand that the high blood sugar is the symptom. And the way I like to analyze it is, if you had a hole in your roof and it was raining a lot and you spend all your time trying to get the perfect bucket to catch the rainwater so your furniture and your floors don't get damaged, well, you're addressing the symptoms. You're not
Yeah.
addressing the hole in the roof. So all of the drugs, all of the diets, all of the exercise are just addressing the high blood sugar. And so while if you do those better than you're doing now, yeah, of course your blood sugar will go down temporarily a little bit lower. But if you don't address the hole in the roof, then it's never going to reverse, which leads us to C is once we get that comprehensive diagnosis, then we can customize what needs to be done specifically for you. In other words, if we do a food intolerance test and you have chicken, lettuce, carrots, onions, garlic, shallots, and oregano, and most people would say, well, those are good things for people to eat, but not for you if it's causing issues. So we
Mm,
have to address everything as a whole picture versus you have this thing wrong with you, this thing wrong with you, this thing wrong with you. And when we pick the right patient, I mean, we rarely see a patient fail. And the analogy I use is that, my grandfather lost his wife, my grandmother, due to the diabetes. And later on, unfortunately, in his life, he became diabetic. And he's like, hey, can you help me? And now I'm much older, right? Than I was when my grandmother, but yet my grandfather wasn't ready, willing, and able to do what needed to be done when I told him what to do. Well,
mm,
if a person's not ready, willing, and able, unfortunately, whatever I tell them to do, even though it might be the right thing, it's not going to work because they're not willing to follow the process. So what we always look for is somebody who's like, okay, I need someone who can find out what's wrong, tell me what's wrong, and then put me on a step-by-step plan to do it. And what I always tell patients is it's simple, but it's not easy. In other
yeah.
words, it's simple for me to tell you what needs to be done, but that doesn't mean it's easy. So there's going to be work. It's not like Staples where you can hit the easy button and everything's done. It's not like that. And unfortunately, there are a percentage of people who are not willing, just like my grandfather weren't willing to do it. And so, what my goal is, I always say, if you're ready, willing, and able, then I'm able to tell you what needs to be done. Like a lot of people, for instance, I'm sure you hear of it too. They think, oh, I need to exercise. But if you're in adrenal fatigue and your adrenals are the glands that sit on top of your kidneys and they're responsible for blood sugar regulation as well as
Mhm.
hormonal secretion, if you're in stage 6, 7, or 8, which means your adrenals are just tired, fatigued, and you exercise, you'll make your condition worse. A good tip for your viewers or for your Facebook group is if you take your blood sugar like 5 seconds before you exercise, and then you exercise, and then you take it 5 seconds after you exercise. If your blood sugar is the same or it went up, you're not healthy enough to exercise yet. You're actually going to make your condition worse. So that's a good little trick that people can do to see, okay, can I start exercise? And if you can, then there are specific exercises which are going to work a lot, or types of exercises which are
Mhm.
going to work a lot better than you just walking on a treadmill every day. That is not the right one. I mean, that doesn't mean that that's bad, but that's not the things that are going to affect the blood sugar the most.
Yes. So you are functional medicine doctor. What is the difference
Correct.
between functional medicine and the regular private, how personal
Well,
PP, what
yeah,
people call?
traditional model. I mean,
Yeah.
what I always tell people is, first of all, it's not your fault if most of you guys are not in the medical field. So it's
Mhm.
not your fault. I mean, what are you supposed to do when you get a disease? You say, hey, let me go to my doctor and
Yes.
tell them, let them figure it out. But I always tell patients 15% of our practice are doctors, nurse practitioners, physician assistants, because they're just trained in a different way. Their training is sponsored by who? The pharmaceutical industry, which is a $2 trillion business. Okay. So if they're sponsoring the doctor's training, what type of tools does your doctor have? Well, metformin, glyburide, glimepiride, glipizide, Actos, Januvia, Farxiga, Invokana, Jardiance, Ozempic, Rybelsus, Victoza, and then all roads lead to what? Insulin. And so it's not that your doctor doesn't care about you. It's not that your doctor's not smart. It's not that your doctor doesn't have your best interest. Your doctor's just following the training. But unfortunately, that model of training is just symptom based. We call that sick care. That's what sick care is where, okay, you have this, let me give you something to make your labs look prettier. But it's not addressing the cause. And when I have doctors who come into my practice as a patient, I always kind of joke with them a little bit. I was like, well, what are you doing here? You're a very highly trained doctor. And they always laugh and they're like, we're not trained to find the cause of the problem. We're trained to, you have high blood sugar. Okay, we're going to give you a blood sugar medication. And part of the standard of care is to give you blood sugar, blood pressure, and a statin. And statins actually cause diabetes. And they give this standard of care medication whether you have the problem or not. In other words, 50% of the people on a statin and blood pressure medication don't even have high blood pressure or high cholesterol or high triglycerides. So why would they be on those medications? Now, I'm not telling you to stop it because you should discuss that with your doctor, but it is something where I tell people, sometimes you have to put on your common sense glasses and like, does that make sense to me? So the difference, to answer your question, is they name the disease and then lower or increase the marker with a medication, which is not addressing the cause, versus what I do or what functional medicine doctors do is we say, okay, let's find out what's causing your issue. Not that you have high blood sugar. We know that. We want to find out what's having that. We fix those problems. And then what'll happen is the symptom will normalize and get better.
Mm-hmm. So you basically, the difference is the regular doctors, traditional doctors, they work with symptoms to bring it to normal readings. You are working with symptoms to avoid the bad readings in the first place.
Exactly. We're getting to the cause of it's like we're going to fix the roof because your floor is getting wet
Yeah.
because you're trying to find this best bucket or the biggest bucket or multiple buckets when maybe we should fix the roof as opposed to finding all these buckets to catch the water. And that, or you if you don't like that analogy, you can think of it like the check engine light coming on in your car. And if you got nervous or anxious because the light's on and your mechanic giving you black tape to put it over top of the light so you don't see it, it doesn't mean that the light's still not on. It just means that you don't see it because it's covered up. But unfortunately, that's not the first thing that most people do. They go to their primary or an endocrinologist, and unfortunately, they all have the same tools. And think about it. I mean, most of my patients, I'm 57 years old. Most of my patients are plus or minus 10 or 15 years of me. I mean, when we were younger, not all these people had diabetes. Not all these people had hormonal issues. Not all these people had food sensitivities and food allergies. Not all these people had Alzheimer's. Well, what does that tell you? It means that the model of care for treating these things isn't working because more people have them. And
Yes.
so, unfortunately, you're in the customer for life program, because think about it. I mean, when has your doctor discussed with you that we're going to stop medication A, medication B? No, it's one pill after the another, one injection, until finally, unfortunately, all roads lead to insulin. Like at church the other day, they were following something, and they said, well, all roads lead to Rome. And it made me think that this is what I tell patients, is that, all roads lead to insulin, because eventually these medications, they're not addressing the cause of your problem. And whether it be a health problem or be a life problem, if you don't address the cause, the problem's going to get worse,
Yeah,
unfortunately.
that's unfortunately. And I personally also I always like to add one more component, that there's a doctor, traditionally trained or trained in functional medicine, in the role of the doctor that you are doing is to diagnose, or to make a choice, what is the treatment plan and all this. But then there is the patient themselves, who have to become participants of this process, because
100%.
so
The
often
patient has to
yeah,
be sorry to interrupt. The
yeah,
patient has to be the number one person in their healthcare. They have to be above all, because at the end of the day, I'm sure, well, I'm not sure, but I know a lot of your members. I'm sure they've had problem A, and doctor number one said to do X, and doctor number two said to do something totally different, and here you are now confused. Well, who's the only person who lives with the decision? The two doctors don't live with the decision. You do. So I think it's very important that I do my best to make sure that I um, try to tell patients what's going on, not with medical terms, but with terms that they understand. So then it makes sense to them, because I always tell patients this: if you knew what I knew, you would do what I do. So it's my job to explain to you in a way that makes sense, so you can be like, you know what, that does make sense. Like if the person, let's say they're taking a statin, which is known to cause diabetes, and yet they don't have high cholesterol and high triglycerides. So I'm not allowed to tell you to change a medication that another doctor prescribed for you. My job is to just tell you the truth and have you make the best decision, because at the end of the day, you're the only one who lives with the decision. So the patient must be the number one advocate in their healthcare, not just be like, okay, doctor told me to do it, so that must be right. No, that's not. You have to be your number one advocate, and the people who support you, your spouse, your kids, your grandkids, or your parent, or how they have to be in line. You can't have people who are sabotaging what you do. Like here you are trying to do the right thing, and then you come home and they have peanut M&Ms everywhere and homemade cookies everywhere, and like if you're hungry, that's going to be very difficult for you not to
mhm.
eat those things if you're hungry and there's nothing else ready. So your parents, your spouse, your brothers, your sisters, these people need to know and be advocates for you, not saboteurs. And part of my process is interviewing a patient is their immediate family. And if their immediate family are going to be saboteurs, we can't take that patient, because they're just not going to be successful, because their family, unfortunately, they're not going to participate for them. They're not going to be a positive influence, basically.
Interesting. I always am saying that the diabetes is a team sport, and you need, as any team,
Yep.
whatever sport you take, they have the coaches, they also have the followers, they have the massage therapists. You need support from every corner in order to become successful team, in order to win whatever tournament you are playing in. And with diabetes, it's very important to have team that is working for the same goal. So,
100%. And what I always tell patients too is that, you know, if you're tired of, like, a lot of patients get with like metformin, they get like diarrhea and GI distress. It's very
yes,
common, right? So
yes.
then if you go into your doctor and you're like, I don't want to take this medication anymore,
Mhm.
your doctor's thinking in the back of their head, uh, well, I didn't know you went to medical school. How are you going to tell me what medication to give you? But once the numbers, this is what I tell patients. My job is not to reduce or eliminate your medications. My job is to join. We are a team.
Yes.
right? And then we make it so obvious that your body doesn't need these medications. And then I teach you how to communicate to your doctor, your prescribing doctor, in their language. So it's not you telling them what to do, but leading them in the right direction based on the numbers.
Yes.
Just like when your numbers get higher, your doctors increase your medications and increase your dosages. Well, vice versa, you need to be able to communicate in a way to them that makes sense to them versus, I don't want to take the medication. I don't like the medication. I don't like the side effect. They know all that, but we need to talk to them in their language. Like if I speak English and you speak French, we can talk all day long, but we're not communicating. Well, that's what happens with your doctors. You need to be able to communicate, not talk, but communicate.
Yes, definitely. Well, Dr. Steven, I am so sorry, but we are at the end of our show right here. I know that this conversation could go a long, long time, and I would like to for you to give our listeners information where they can find you, because I'm pretty sure that there will be some people who have more questions for you. So how they
Sure.
can reach out to you?
They can reach out. My website, the easiest one is doctor with doctor spelled out. So DOCTOR, wander, like wander around the block, WANDER. So drwander.com. And also they could text us at 301-637-4022. And I always tell patients the best sort of taking the first step forward is to really watch one of our educational webinars, which periodically I do live ones, but I also have taped ones. And if they get in touch with us, we can give them the proper link so they can sign up, because that is gonna, it's a good way of someone to hear kind of the story from the beginning to the end where we're not rushing. And then at the end of that, if someone is interested in seeing are they a good candidate for what we do, there would be an opportunity for them to secure what we call a strategy session, which
Yes.
means we start with a strategy session so we can see, okay, this is the next step, and is that something that you're interested in? And if it is, we go over all the details, and if it's not, that's okay as well.
All right. Okay, perfect. So, in the comment section for this show, I will put the links to your website and the phone number that you offering people. I'm very rarely seeing somebody giving their phone numbers, but look, you are offering that
No, it's
opportunity.
just for clarification, that's not my personal cell phone.
Yes,
That
I
is the cell
understand.
phone number we use for the office. But
Yes.
uh,
Well,
yeah, go ahead.
this is a great thing because a lot of offices, medical offices or any other business offices, if they have the office number, it doesn't receive the texts. And
Right. And I also want to make the point that since COVID, so before COVID, I had a physical location outside of Washington, D.C. for 20 years. But we always had patients from all over the world, really, because the people would find us.
yes,
Um, but since COVID, our entire practice is virtual, meaning you don't need to be in my city. And actually, the treatment is so much faster, more efficient, easier. Everything is better about it. So patients don't have to worry about, well, I live in X, but sometimes patients like to go in and see their doctors face to face. And if
yes.
they prefer that, I can try to see if I can recommend someone if I know someone in that metropolitan area.
Absolutely. Well, great. Thank you. Thank you, Dr. Steven. Thank you for finding time to meet with me. I know your schedule is tight, but it's always great to hear the information that it will be helpful to many. And hopefully there will be some people. You do take new patients, right? It's not that,
Correct.
okay. So people will be able to reach out to you and see maybe you could take them. As your patients as well.
Yeah, and I'd just like to make one quick point. When I found your group,
Mm,
I always think that for some reason that people like they know some of the information, and unfortunately, a lot of the stories that I hear the people in the group saying, as well as unfortunately, they're looking for advice for some people who, let's just say, they're experts in different areas, and the advice that is given is not typically the right advice, unfortunately, of what I see. And it's very frustrating on my part because, the people are looking for help. And unfortunately, a lot of the information is not what I would say correct. Let's just put it that way.
I understand what you're talking about, and I was thinking about this situation for a long time, and the best reason for it I find this is diabetes 101 for beginners. The
That's
first
right.
people who find this place are the beginners. They learn something and they share their opinion, their expertise, not really expertise, but their
Understood.
experience,
Yes.
but it's not like one to one. What helped to one, it doesn't necessarily help to other, but make it like it cover like a blank cover for everybody. It's not working
Right.
like that. And I think this
Right.
is the reason why we see so many recommendations that are not necessarily the good recommendations for everyone. This is why I invite experts to this show, so we could offer people at least names of people and places where to look for people like yourself who can help them to get the results and they're looking for and to get the answers they're looking for. So thank
Right.
you for being there for us and talking with me today. And
My pleasure.
everybody, I will see you next Thursday. But for today, this is it. Have a great day, and we will be on air on our YouTube, Facebook, LinkedIn, anywhere you could find us. Thank you.
Okay. Thank you. Bye bye now.